So, are you having difficulty with sleep? Are you having a hard time getting to sleep, staying asleep, and wonder what's up and how you can address it? Let's talk about it. Hello, my loves. Dr. Holly here, tuning in to talk to you about insomnia and sleep and all the things that people come and talk to me about as an integrative psychiatrist. So, sleep. What is normal sleep? I mean, so many people have different theories, right, about needing to stay asleep through the night and whether or not it's okay to be waking up. Well, first of all, it is actually pretty normal to wake up during the night. Back in the day, before the Industrial Revolution, people would actually wake up at around 3 in the morning and socialize. They would go to each other's houses, to their neighbors, and get in each other's beds and have snacks and do all the things. So that's actually not unusual to wake up in the middle of the night. What becomes difficult is if you have a hard time falling back asleep, right? People who come to me and talk about their insomnia usually say they either have difficulty falling asleep, like they're sitting in their bed wondering why they can't just make sleep happen, or they're waking up maybe to go to the bathroom, maybe they're not really sure why, and then they can't fall back asleep. And so those things can lead to some distress. And that distress is what leads to us categorizing that as insomnia. So with the insomnia, I oftentimes will evaluate what's going on in that person's life, because insomnia can often be the symptom of something else. Now, it's not necessarily just the primary cause of all the distress. Maybe the person is not breathing during the night. Oftentimes people have sleep apnea and don't even realize it. So if you're snoring or stopping breathing or have any kind of unusual behaviors when sleeping, that's an indication that it's a good idea to go and maybe get a sleep study. And there's various places you can do that. If you maybe have some heat or cold intolerance, there might be some issues with your hormones. We oftentimes will look at thyroid, or sometimes folks with diabetes will have their blood sugar lower during the night and their body's waking up because it can't feed itself. There's also pain concerns that can lead to some insomnia. And then just all the things that people see me for outside of insomnia, like depression, anxiety, PTSD, all these things can contribute to sleep issues. So it's important when you are having those things to look and reach out to your physician and try to address the root cause, because if those things aren't addressed, sleep itself is not necessarily going to get better, even with some of the over-the-counter things and medications that are used for sleep specifically. So when I'm evaluating someone for sleep, I do look at those things, and then we talk about their environment. Like, what are things like for them when they're going to bed? Do you feel safe where you're sleeping at night? Are you comfortable if you have a partner with that partner there in the bed with you? If you are going to sleep, do you have all the things on? Do you have the TV on? Do you have the lights on? Do you have a lot of blue lights, like the clock or whatever kind of lights, your computer lights looking at you in the nighttime? Any type of light source is going to tell your brain to stay awake. Any type of sound, even if you feel like having the TV on is helpful to you, talking especially is going to trigger your brain to stay awake and try to pay attention to that. So looking at your environment and adjusting your environment so it's going to be more conducive to sleep is super important. When we look at someone's sleep, we go back to, again, that pre-industrial time when we didn't have all the lights and all the things telling our brain to stay awake. We adjust our environment to lowering the lights, maybe coming up with a ritual that helps you feel more relaxed at night. That might be a meditation. If you do feel like you need sound at night, maybe there's some relaxing music, or there are certain types of meditations or guided imagery, we call them, that can help people relax to sleep. We use that sometimes with kids when we're telling them a bedtime story. That helps their brain relax, feel safe, and drift off, which is really what you're doing. You're letting sleep take over. You're letting that sleep drive take over. Something else we can do is taking advantage of the circadian rhythms. So making sure during the day you're outside and getting that sunlight, telling your brain this is the awake time, and then not napping, staying up, getting up at a certain time every day. And then that tells your body that this is awake time. And then later, when I'm turning on the lights and doing all the things that are in my ritual for bedtime, it's time to go to sleep. So those are some behavioral things you can try. There's also a lot of mind-body medicine, things that we try with yoga, Tai Chi, meditation. All of these are things that we can talk about when you come to an integrative psychiatry appointment, or if you're seeing one of your providers for those services. Finally, if folks are still having difficulty, even when they do these behavioral things, they oftentimes want some type of medication. Now, there's a lot of hypnotics that are out there. Those hypnotics attach onto your GABA receptor in your brain, but they don't necessarily stay there for very long. So they can have a rebound effect when they come off of that GABA. They also, a lot of those hypnotics cause memory issues. So for some of my folks, I love to see my folks with traumatic brain injury and cognitive issues. If they are using that type of medication, that's actually going to worsen those complaints. And they've actually found some studies that if you take those medications for just a few weeks, you can increase your likelihood of mortality pretty significantly. So those aren't things to necessarily take in the long term if you can help it. In integrative psychiatry, I look at folks, like I said, at their root cause, and there's a lot of different supplements and herbal remedies through Ayurvedic medicine that I'm able to recommend that folks have found to be super helpful for sleep. So if you are interested in anything that I've been mentioning today and want more information, please feel free to reach out. You can find me on darawellnessnola.com. There you can get a free discovery call, find out more about what I have to offer in my one-on-one, and I'm going to be developing some group sessions for folks in a community that we can all join together and kind of work through these things together. Also follow me on YouTube and Facebook, Instagram, LinkedIn, wherever you happen to be seeing me right now, so you can get more tips as we go along. But it is great to talk to you. Have a wonderful rest of your day and a wonderful evening, and I hope it is relaxing and allows you to sleep well. All right, sending love.